Hi guys, welcome back to my channel. My name is Jevonim. I am a travel nurse, and after doing 1 week of work, I am quitting my job. Yes, I am quitting my job. I have done 36 hours of work at a new hospital, and the Monday of the next week, I put in my 2-week notice. Nursing can be abusive, okay? I've had enough of it. I am 8 years in, so now I think I know what my standards are for the hospital that I'm working for, that I'm just not taking things anymore. Like, I just don't have to. I'm fortunate enough to be in a job market where I can truly decide how much abuse I can take. And this hospital that I'm at now, no, I just can't do it. Personally, I can't. Here's the thing. Working 12 and a half hours means that we have to take breaks, okay? 12 and a half hours, 7 to 7:30 means I get to take 30 minutes uninterrupted. Just 30 minutes to scarf down a meal uninterrupted. And then I can take 2 15s interrupted. Meaning if I go get a water, a doctor can call me. I've gone to the bathroom and had a doctor knocking on the bathroom door because they wanted to pass on a message before they leave. Like, these doctors can go to a whole room, sit down and chill, but you're going to really knock on the bathroom door because someone told you I was inside because you have a message for me, doctor? The disrespect. I can't do it. No, I have standards now. 8 years in, no, we're not doing that. I'm getting really sick and tired of working and going to the break room to eat and someone leaving a message. Like, if I endorse my patients to a nurse and I'm like, hey, I'm going on break, I expect you to be able to take messages. I expect you to be able to pass things on to me when I get back. I don't need you coming to the break room and telling me, hey, the doctor needs to ask you a question. Yes, you may not be able to answer it, but I'm on uninterrupted break. Why can't you tell the doctor, hey, just message the nurse, or can I leave a message for you? She's eating. Not, hey, the doctor needs to speak to you. I'm like, 30 minutes in 12 and a half hours. That's all I need. It's not all I need, but that's what's been given to me. That's what I agreed to. I can't take the abuse, guys. I can't do it. And this particular hospital that I'm at, yes, it's in a rougher community. We all know this. That's fine. Listen, I grew up from Patterson, New Jersey. Like, I didn't grow up in a small little community, okay? I can handle things. As a travel nurse, I already expect to handle things. They put you in whatever unit that needs help. That's fine. But I understand now that I have to have certain standards in place in order for me to feel safe. Yes, I know that if I'm working in certain communities, they may not have all the resources. I understand that. But we need standards of care, okay? This particular hospital that I'm working for right now, I feel unsafe. Listen, I feel unsafe. I don't want to share too many details because I'm going to keep it professional. But let me tell you, when you are a nurse starting off, you're going to hear a lot of times of people talking about you needing to protect your license. And that is so true. I am so fortunate that the first hospital position I worked at, I had a manager who would come to work at 3 or 4 a.m. in the morning to make sure that night shift was doing what they needed to do. And then she would stay over to the day shift. So she got to meet everybody. She was making sure her unit was top notch. And I remember one time I made some kind of mistake and she was questioning me and she was like, is this the response you're going to give when you go to court? And I was like, you right, girl. All right, let me tighten up. And I have tightened up ever since. Do I make mistakes? Yes. Life-threatening, harmful mistakes? No. I am human, but no, there's certain things you just know you need to do right to protect yourself. And these hospitals sometimes will put you in positions where you're like, this is just not safe. This is making me a liability, and I don't appreciate that. So no, 2-week notice. Moving on. I can't do it. Listen, 36 hours may not sound like a lot, but when you're spending 12 and a half hours dealing with saving lives, you have to set standards in place. I could not do it. The biggest thing that also is really starting to get to me is I do feel like, while I will say there are nurses who are not doing their job. I've seen it. I've seen nurses who are not doing their job, but it does not help when corporations are also punishing nurses because it's preventing them. It's like not motivating people to do their job. Look, nurses need to do their job. I understand that. 100%. But for example, the hospital I'm at now, I remember when I was on orientation, first thing they told me is, please make sure you don't have a fall. Of course. I hate falls. I don't like doing the paperwork for falls. I don't like calling the family to tell them that the patient fell. But patients are stubborn. Sometimes they feel like right after surgery, they can get up. And though I set the bed alarm and I set parameters, I cannot control somebody, okay? I cannot hold somebody down, all right? If I'm with another patient, any of my 6 patients, and I'm telling this patient I have a bed alarm and I need you to call when you need help, and they just want to get up, can't stop that. But when a hospital is telling you don't have a fall because the paperwork is just so much, like it's so much, you're not going to have nurses reporting falls. It ain't gonna happen. People are not gonna be motivated to report falls. And I'm seeing it where I'm at now. Like, I had a patient who had an unreported fall. And I'm like, the reason why these nurses are not reporting falls is because you're like punishing nurses for the falls. And then the first thing you tell me on orientation is, make sure you don't have a fall because it's a lot of paperwork. Yeah, you're punishing nurses. They're not gonna report. The last hospital I worked at, we worked on a surgical floor and falls were huge and they were happening a lot. And we had to set so many parameters. Everyone was on fall precaution. High fall, low, you were on fall precautions. Rain or shine, you overnight stay. You're using no walking device. You're still on some kind of fall precaution. And we're going to have the alarm on. But the thing is, when there was a fall, the nurses were reporting it. It was simple. Do this, do that. Yes, you have to call the doctor. Yes, you have the imaging. Yes, you have to do this, and that. But it was simple. It was not punishment. It was just part of the process. When you're giving someone a stack of papers to report a fall, you're not going to get these nurses reporting falls. They're not going to do their job, which is terrible. But that punishment system is not working. That's also abusive as well. So, no, I don't like that. I was just like, I'm not liking this. I did not feel safe. Nurses, you have to feel safe where you work. And so, yeah, I did 1 week and I'm putting in my 2 weeks notice. Oh, it's already in, actually. I'm on my last week and then I'm out of here. I already have another position lined up. I gotta feel safe, okay? This license will be protected. I will do my job, but I need to work in a hospital that is going to also allow me to do my job safely. So, yeah, this is just me giving a little story as to what happened. I hope you guys are staying safe. I hope you are setting your own standards of practice if you are a travel nurse or just a regular nurse or just working at a job. Okay, you need standards. Okay, standards of work. All right, guys, that's it. Thank you for joining my video. Please watch out for the next one, and I will see you later. Bye. Loving that you're a patina. Here long, the goodness amazing.